We asked you what questions you had for us, so now I'm going to answer. First, this person asked if I can simplify dysautonomia, so let's do it. Dysautonomia is an umbrella term used to describe several different autonomic nervous system disorders. The autonomic nervous system is a network of nerves throughout the body. It's essentially our body's communication network. The autonomic nervous system regulates the involuntary responses of the body. Involuntary responses of the body being things that we don't have to think about, we don't have to manage, they just happen. That includes respiration. Obviously, we are not sitting here every day going, okay, I'm breathing. We don't have to think about it. It just happens. And if it didn't happen, there'd be a problem there. Other body systems that our autonomic nervous system regulates, digestion, we don't have to think about digesting our food, heart rate, blood pressure, we really can't consciously control those things. But the problem in dysautonomia is that autonomic nervous system doesn't function properly. Because of that can lead to dozens of symptoms across multiple body systems. So to summarize, dysautonomia is the dysfunction of the autonomic nervous system. Autonomic nervous system regulates involuntary responses of the body, the responses we don't have to think about and make happen. I just saw a bird land on my windowsill. And because it's not functioning properly, that leads to a bunch of symptoms because our bodies are going, wait a minute, what's going on? I don't know what's happening. I don't know how to function properly. So I hope that makes sense. What is the difference between our Electrolyte Fastchews and our salt capsules? Our Electrolyte Salt Capsules make it easier to hit your sodium goals. Now you may have noticed we have two different kinds of electrolyte capsules. What's the difference? Our original electrolyte capsules have 500 milligrams of sodium per 2 capsules. Our extra strength electrolyte capsules have 750 milligrams of sodium per 2 capsules. Another difference between the two is the size of the capsule. The extra strength electrolyte capsules are 00, whereas our original electrolyte capsules are size 0. That means that they're just a little bit smaller than our extra strength capsules. It's also important to note that our Electrolyte Salt Capsules are flavorless capsules, whereas our Fastchews are flavored chewable tablets. The Fruit Punch Electrolyte Fastchews, which I have here, the great thing about them, which makes them different from the salt capsules, is that they're fast acting. They have been clinically proven to start working in under 45 seconds. I always make sure I have them when I'm out of the house because I have presyncope so many times throughout the day. I am experiencing presyncope more often than not. And that can be really scary, especially when I'm out of the house by myself, like coming home from an appointment, going to the pharmacy. So if I start feeling really bad, if I start getting shaky, lightheaded, I'll chew a couple of these and I come around so quickly. So these are really for immediate relief. The salt capsules are for more long-term, meeting your sodium goals for the day. And if you're planning on buying them, make sure that you're part of our Vitassium Club. It's a free program for people who use our products to manage symptoms of their chronic illnesses. You can sign up for it on Vitassium.com. It gives you up to 25% off products with free shipping on certain orders. And if you've never tried them before, but you're hesitant to buy a full bottle, we also have a free sample pack on our website at Vitassium.com. You just have to pay $4.99 for shipping. Highly recommend you give these a shot. How do I deal with the sadness that comes with chronic illness? First, I want to say you are absolutely not alone in how you feel. Chronic illness can, 1, be so isolating, and 2, so many of us grieve who we used to be. And there's nothing wrong with grieving who you used to be, grieving not being able to do the things you used to be able to do. Honestly, social media is one of the best tools we have for connecting, especially because so many of us with chronic illnesses are also disabled. We don't go out that much, especially with COVID still going around. It can be unsafe for a lot of us. It helps so much making friends online in the community, to be able to talk to people who understand what you're going through and who understand what it's like to be chronically ill and disabled. But I know a lot of people face barriers in community building as well. So let's go over a few ways you can build community. So there are online community-based options that are either low cost or free, and they can be done from bed. Facebook groups, if you look up your specific diagnosis, there's a POTS Facebook group. If you're looking up your location, there's a Chicago EDS Facebook group. You can also look up your demographics, so there's actually a POTS Teens Facebook group. You can also find community on Discord servers and Reddit communities. A lot of times you can find free virtual support groups and meetups. Now, some low-tech or no-tech options for people who don't have access to reliable internet or technology. You could try phone-based peer support. Some nonprofits or mutual aid organizations offer check-in buddies. You can ask local disability or rare disease clinics if they offer this. Also, pen pals or snail mail communities. There are organizations like Letters Against Isolation or More Love Letters. You can also check in with local libraries or churches. They often have free Wi-Fi, quiet space, bulletin boards where you can hopefully find some support groups. Now, on to the next question. Have you ever had a dysautonomia flare after crying? Absolutely. But I will say I've never had 2 different sized pupils. My pupils are frequently dilated, as you may have seen in some other videos. Even when I'm in front of a bright light, my pupils are giant. But that's also part of dysautonomia. And unfortunately, I think it's pretty common for people to have flares after they've been crying, especially if it was a big cry. Someone asked if I experience more flare-ups when I'm manic. I have bipolar 1, and the answer is yes. Even with hypomanias, which are essentially less severe forms of mania, they don't last nearly as long. Typically, hypomanias don't significantly impair daily functioning, whereas with manias, daily functioning can be significantly impaired. Now, I would hazard a guess that most of the people with bipolar disorder and chronic illness experience flare-ups either during or after their episodes, and that's because they just put so much stress on the body. And I think one of the biggest things that contributes to this is that when you are having a mania, you don't sleep, at least in my experience. Even with hypomania, sometimes you don't sleep. Throughout my episodes, some of them lasting a couple of months, I'm burning spoons constantly that I don't have. So when I finally come out of it, I'm like, oh no, and it takes me forever to recover. What does an average day look like for me? So unfortunately, I'm still at the point in my health journey, I don't like saying that, it sounds so cheesy, where I'm still having several appointments a week, typically 3 to 4 appointments. I have physical therapy, so of course I wake up, I try to have breakfast. I can't have breakfast because I'm so nauseous. I'll get like 1 bite of toast. I'll head to physical therapy for an hour, hour and a half. That's something I've been doing for more than 2 years now, every week. Sometimes I'll have an appointment immediately following physical therapy. I try to schedule my appointments on days where I already have other appointments so then I can have more weekdays off. And then after physical therapy, I'll get a little treat, because getting a little treat after any kind of appointment, blood work, imaging, any kind of testing is absolutely necessary. Go get a little treat. And then I'll get home. I of course will change my clothes because I do not need outside clothes in my inside apartment. Like, I don't want those on my couch or in my bed. Then I'll usually be so exhausted from physical therapy that I'll have to lay down. I'll take a short nap. And by short, I mean like 2 hours. I would probably sleep longer, but my cat always wakes me up asking for treats. Then after that, I'll work on some content, either for Vitassium or for my own personal social media channels. Dinner varies widely depending on how I feel. Usually on Thursdays, I'll do something simple like boiling pasta and putting butter and like some garlic powder on it. After I eat dinner, I'll usually call my mom. My mom and I usually talk for at least an hour every night. I finally get my first wind of the day at like 9 p.m. I'm like, whoa, my body has finally adjusted to gravity. I feel like I might be able to do something I enjoy. So sometimes at night after I've talked to my mom, I'll just do a little bit of sewing, which just makes me happy to do something that isn't health related. And then I'll just get ready for bed, make sure my cat Mimi, who's sleeping under that blanket, she's so cute, is fed, litter box is cleaned, and then I just get in my bed and I scroll on my phone for too long, and then I finally go to sleep. So if a physician says dysautonomia is just a panic attack, what would I say? That is super tricky, and I don't blame you for being like, what should I have said? My answer to this would have been very different like a year and a half ago. In the last year and a half, I've really locked in to learn everything I can about dysautonomia, about POTS. So now I would easily be able to correct them. I would easily be able to pull up peer-reviewed journals and studies and say, oh, look here, let's read this together. That is not true. But before I knew better, I probably wouldn't have known what to say. I would have been like, are you sure? I don't know. So I don't blame you for not knowing what to say. I wish I had a better answer for you. Next, what's the diagnostic criteria for all the types of dysautonomia? Unfortunately, if I answered this question, we would probably be here for a year because there are more than 15 types of dysautonomia. Maybe I'll make a series explaining each type of dysautonomia, but for right now, let's quickly go over the internationally accepted diagnostic criteria for POTS, since POTS is the most common and most researched. So the first piece of diagnostic criteria for POTS is that there must be a sustained increase in heart rate of at least 30 beats per minute within the first 10 minutes of standing. For individuals 12 to 19 years of age, that increase has to be at least 40 beats per minute. The second criteria is that there must be an absence of orthostatic hypotension. Orthostatic hypotension is a significant drop in blood pressure of at least 20 systolic or at least 10 diastolic within the first 3 minutes of standing. Third criteria is that there must be frequent symptoms of orthostatic intolerance with rapid improvement of symptoms upon returning to the supine position. The fourth piece of criteria is that there must have been symptoms for at least 3 months, of course, which makes sense, it's chronic illness. And then the fifth piece of criteria is that there must be an absence of other conditions that could explain the tachycardia. Things like anxiety, anemia, dehydration, hyperthyroidism. Because I know a lot of people see that and go, wait, does that mean if I have anxiety, I can't have POTS? It does not mean that. It just means these are things that must be ruled out or must be managed before one can get a POTS diagnosis. So for example, if someone is treated for dehydration and their tachycardia goes away, then they had dehydration and not POTS. If a patient is treated for dehydration and their tachycardia persists after they are no longer dehydrated, then they could have been dehydrated and also have POTS. This is a good time to say that POTS is not anxiety. And I know a lot of people in our community who have run into doctors who believe that that's untrue or who simply don't know what POTS or dysautonomia is. So how can we prepare for an appointment with a new provider? There are a lot of great resources for this, with Dysautonomia International being one of the most valuable. If you go to their website and you click the Learn More tab in the top left corner of the page, that will redirect you to a place where you can find educational materials. Of course, when it's a new patient appointment, we want to be prepared in case we get one of those doctors who doesn't believe in POTS or who tries to tell us it's anxiety. That sometimes means bringing educational materials to go over with your doctor or to give them. And as you can see here, they have a lot of educational materials. So 10 facts about dysautonomia, they have one about POTS, which has a lot of really great information in it. At the bottom, you'll see information kits for doctors. And of course, on the previous webpage, I also have quite a few medical journal articles listed on different types of dysautonomia. POTS UK also has a lot of really valuable information. For example, this tests and diagnosis page, they show you a lot of the tests that you may end up getting for POTS, but they also have a tips for obtaining a diagnosis flyer that has a lot of great information and several really helpful links. So for example, they have a one-page leaflet you could print and give to your provider. Before your appointment, you should also make sure that you have your entire medication list ready to go, and it doesn't hurt to practice what you're going to say. Think about how you're going to explain your symptoms. Try to be really specific. For example, when you're talking about how long you've been experiencing these symptoms, be really specific and say, I've been experiencing them for, let's say, 7 months, rather than just saying, I've been experiencing them for a while. Being specific gives them a lot more information and a lot more context. Another example of being specific when describing your symptoms, if you just say, I have stomach pain, that doesn't really tell them much. But if you say, I'm having really bad stomach pain, it's in this specific area, and it feels like burning, twisting, aching, that's a lot more information than I have stomach pain. I know going to a new patient doctor's appointment can cause nerves, so practicing and knowing what you're going to say ahead of time will hopefully alleviate some of that. Something else you can do is plan to bring someone with you. You can catch them up with things you want to make sure that you say, questions you want to make sure that you ask, so if you have a little brain fog moment, then they can help you out too. How do I cope with my flushing episodes? These are just a couple examples of the flushing that I get. I will say I do have mast cell activation syndrome. That's what we believe is causing my flushing episodes. Unfortunately, I haven't really figured out how to stop them, especially if I'm in a flare. They're just gonna happen even though I'm medicated from my MCAS. But they obviously get very hot. My cheeks sometimes get swollen. They're very tingly. So a lot of times ice packs can help. If I have the spoons, I might take a cool shower. I will also crank my AC up because usually it happens when I get really hot. That's the first trigger. I try to drink a lot of really cold water, which sometimes helps. And of course, the best thing to do if we could figure it out was to avoid known triggers. This question is so real, and the answer is absolutely yes. And how I'm feeling is absolutely dependent on how symptomatic I am that day. Of course, if I'm very symptomatic, I'm very grumpy, I'm angry at the world. But yeah, I think that's a really normal thing to feel. And I feel comfortable guessing that almost all of us with chronic illness and disability have felt that way. How do we advocate for ourselves in the emergency room? First is being prepared. Earlier on in my health journey, I used to have a really big medical binder that I would take with me to every appointment because most of the time they had the information they needed. They could see my test results. But there were several times in really important high stakes appointments where they didn't have it, and I was able to say, no worries, let me flip right here. Here it is, look. Also make sure you have a list of your medications. That can be really helpful and also save time. And try to prioritize your symptoms if it makes sense, trying to focus on the more urgent issues first. So for example, when I went to the emergency room last, this is gonna be TMI, GI issues, I was having horrible stomach pain, like to the point where I was screaming, crying, writhing around. Of course, I made sure to mention that first, explain all of that in detail to them, and then I said, oh, and also I'm having a lot of diarrhea. And don't be afraid to ask questions. If they put you on medication, you can ask, what side effects should I look out for? You could also ask, are any of my lab results relevant to this? What is your differential diagnosis? That means you're having symptoms that could be attributed to several different conditions. So your differential diagnosis, which ones do you think are the most likely for me? So for example, if a patient is presenting with chest pain, shortness of breath, there are a lot of differential diagnoses it could be. Heart attack, pneumonia, anxiety disorder, pulmonary embolism. So the physician will have to perform a thorough evaluation. And then through the results of that testing, they might at that point determine the most probable cause. So I would say advocating for yourself effectively starts with preparation and continues with communication. Don't be afraid to ask questions. Don't be afraid to go into a lot of detail about the symptoms you're experiencing. And of course, it's ideal if you have someone that can go with you to help you advocate for yourself, and hopefully all will go smoothly and you will not be met with gaslighting. So that's our Q&A. Thank you for asking those questions. Let us know in the comments if you have any other questions, and don't forget to head to Vitassium.com to sign up for our free Vitassium Club and to order your free samples. Stay salty!